Hello everyone, this is Doctor Ananya. Welcome to my channel. In today's video, I'll be talking about symptoms of TB, that is tuberculosis. Before beginning this video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us quickly understand what is TB. TB stands for tuberculosis. It is a type of infection that spreads through the air. This infection is caused by a bacteria called as Mycobacterium tuberculosis, and hence it is a bacterial infection. TB mostly affects lungs, but in some cases it can spread to your kidneys, your spine, and your brain. As I told, TB is an infectious disease and can be spread through air, but it is very difficult for you to get TB. You have to be in contact with the contagious person for a very long period of time in order to get TB. And in some cases, you may have TB, but you might not get sick. And if you get sick, then you might need a treatment. Also, if you get infected by TB, then you may not necessarily have the symptoms or you will not necessarily get sick. Some people will have latent TB for a lifetime, which means they will have TB without any symptoms or its effects. And whenever the person's immune system becomes compromised or weak, this latent TB can turn into active TB. And there is one more important thing. Bacteria can only spread if you have active TB. Bacteria do not spread if you have latent TB or inactive TB. So TB is most common in people who have compromised or weak immune system. Now let us talk about the symptoms of TB, that is symptoms of tuberculosis. As I told, TB mostly affects lungs. You'll have symptoms that are more related to lungs, which includes breathing problem. Number one is bad cough. People with active TB infection can get bad cough, which can last for more than 2 weeks. The cough can be dried or it can be accompanied by mucus, but the time span is longer than usual. So if you or someone you know is having a bad cough that lasts more than 14 days, you must get a test or visit a doctor. Number two is chest pain. People with active infection of TB experience chest pain. This is because TB bacteria affects the lungs. Number three is coughing up blood or mucus. Cough is one of the most common symptoms of TB, and people with TB will have cough with the mucus, that is sputum, or there will be blood in the mucus. So it's important for you to watch your symptoms carefully. Number four is fatigue or weakness. You may also experience fatigue or weakness if you have active infection of TB. Fatigue means feeling of tiredness without doing any physical work. The next one is loss of appetite. People with TB will have loss of appetite, which means they will feel less hungry or they'll not have urge to eat. And this loss of appetite can lead to the other symptom, that is unexplained weight loss. You might have noticed people who are suffering with TB are losing weight without any reason and they are getting slimmer day by day. And here, instead of the word slimmer, I would like to use the word lean, because it is unexplained weight loss. People can also get fever along with chills and night sweats. So these are some of the very common symptoms of TB or tuberculosis. But these symptoms are not specific to TB. And people with active infection of TB may not necessarily have all the symptoms. And the intensity of the symptoms can vary from person to person. So if you have any of these symptoms for a long period of time, especially if you have cough for more than 14 days, that is 2 weeks, it is important for you to visit a doctor. Your doctor will ask for your medical history, your symptoms, and may order a few tests. Your doctor can either ask for TST or IGRA. Both of these are the screening tests for TB. Along with this, your doctor might also order other blood tests. If you're positive in the screening test, then your doctor may ask for the sputum test, CT scan, and X-ray. If the diagnosis is confirmed, your doctor might talk with you to develop a treatment plan that works best for you. If the diagnosis is not confirmed, then your doctor might order some other test, which will help him to find out the exact reasons of why these symptoms are troubling you. So it is important for you to let your doctor know about all the medications that you are taking, including the OTCs, that is over-the-counter pills such as paracetamol. Along with this, you must be very clear in telling about your medical history. And it's important for you to follow all the instructions given by your doctor and complete the treatment. So do not start or stop any medication by yourself, and always consult a doctor before starting or stopping any medication. So here's a question. Can TB be prevented? And the answer is yes. TB can be prevented. The most important measure to prevent TB is to maintain ventilation if you are living in a room for a long time or if you are in a hospital for a long time. Along with this, to have safety precaution measures. You can also have proper personal protective equipments to get prevented from TB. Along with all this, maintaining a healthy lifestyle and a healthy diet, which comprises of high proteins, fruits and vegetables, may help you prevent this disease and other diseases. And that's all for today's video. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.